So guys, we begin with the rapid revision of neuroanatomy. Neuroanatomy, rapid revision. Okay. So what all we have to see? That your nervous system is divided into two parts: the central nervous system and the peripheral nervous system. Okay, your target should be learn with me in the class only. So nervous system is divided into two parts: central nervous system and peripheral nervous system. The central nervous system has two parts: brain and spinal cord. So if they ask you brain and spinal cord, they are parts of the central nervous system. Then what are the parts of the peripheral nervous system? Somatic nervous system and the somatic nervous system and the autonomic nervous system. Somatic nervous system and the autonomic nervous system, they are parts of the peripheral nervous system. Okay, in the somatic nervous system we have the afferent nerves and efferent nerves. Okay, so in body there will be two types of nerves: one which will bring the message towards the brain and one which will take the message away from the brain. Okay, so the nerve which brings the message towards the brain is afferent. The nerve which takes the message away from the brain is efferent. So remember, afferent nerve approaches the brain, efferent nerve exits the brain. Okay, this will help you in MCQ. Then in the autonomic nervous system, there are two types of nervous system: sympathetic nervous system and parasympathetic nervous system. Okay. From here, please expect this question: division of the parasympathetic nervous system. Okay. Then afferent nerves versus efferent nerves. Now we will see sympathetic nervous system versus parasympathetic nervous system. So autonomic nervous system is divided into two systems. One is sympathetic system and other is parasympathetic system. One basic difference that you need to remember for your understanding is sympathetic nervous system is the one which gets activated during the phase of fight and flight. That is during stress. Let's say a dog is running after me, okay, and I am scared of the dog, so I will also run. This is stress for me. My sympathetic nervous system gets activated, whereas parasympathetic nervous system is opposite of sympathetic nervous system. It is for relaxation and rest. Okay, but if they ask you, main difference lies in the origin. Sympathetic nervous system originates from the thoracolumbar vertebra, whereas the parasympathetic nervous system, it originates from the craniosacral. Craniosacral means brain and the sacrum. Okay, just the basics. Then sympathetic nervous system, what I told you to remember was that in the sympathetic nervous system, this is ganglion. So in the sympathetic nervous system, the preganglionic fiber is longer than the postganglionic fiber, and it is opposite here. In the parasympathetic nervous system, the preganglionic fiber is shorter. So what is preganglionic fiber? See, when the sympathetic nervous system has to interact with the target organ, it does not go directly. It takes rest and then it goes. So the place where it takes rest is the ganglion. Okay, the place where it takes rest is ganglion. Fine. So in the sympathetic nervous system, it is seen that the ganglion is near the target organ. So this fiber, which is pre to the ganglion, the preganglionic fiber is longer and the postganglionic fiber is shorter. And it is opposite in parasympathetic nervous system. In parasympathetic nervous system, the preganglionic fiber is shorter and the postganglionic fiber is longer. Okay, because ganglia is located close to the origin. Okay, now You will tell me the functions of the sympathetic and the parasympathetic nervous system. Come on, fast. Sympathetic nervous system and parasympathetic nervous system. You will tell me the functions. Come on. See, sympathetic system. Just remember fight and flight. Fight and flight. Okay. Just remember. So when you are running, when you are fighting, heart rate increases. BP increases. Pupil, because you have to run, you have to see at a longer distance. Okay. So you want more light to enter, and more light to enter, that means that the pupil should dilate. Pupil dilates. Okay. Heart rate increases, BP increases, pupil dilates. Okay. Whereas in the parasympathetic nervous system, heart rate decreases, BP decreases, and pupil constricts. Now, they will ask you which is the main neurotransmitter. Main neurotransmitter for sympathetic nervous system is adrenaline and noradrenaline. Whereas main neurotransmitter for parasympathetic nervous system is acetylcholine. Remember this, okay? Fine? Come on. Next topic is cranial nerves. Okay? How many, see, in the body, nerves are divided into two parts, cranial nerves and the spinal nerves. Cranial nerves are 12, spinal nerves are 31 pair. Okay? 31 pair. Remember this? Cranial nerves. Give me the name of 12 cranial nerves. Come on. We have done it. Come on. First is olfactory. Olfaction means smell. Second is optic. Optic means vision. Third is oculomotor. Fourth is trochlear. And sixth is abducens. And third, fourth and sixth, they are for movement of the eye. Motor movement of the eye. Fifth is trigeminal. Seventh is facial. Eighth is auditory, or other name is vestibulocochlear. Ninth is glossopharyngeal. 10th is vagus. 11th you don't have to remember, accessory spinal. 12th is hypoglossal. Okay. So if we talk about olfactory nerve will carry which sensation? Smell. Optic nerve will carry vision. Third, fourth and sixth, these will carry oculomotor. These will carry the movement of the muscle. Like if these nerves are intact, then we are able to move our eyes in all the directions. Okay. And we remember a formula, SO4 LR6 remaining from third. This solves all our questions related to vision. Okay. See, if they ask you which muscle is supplied by trochlear nerve, fourth nerve, superior oblique. If they ask you which muscle is supplied by abducens nerve, lateral rectus, and any other muscle, the name they take is supplied by third cranial nerve. This we remember, SO4 LR6 remaining from third. Okay. This is more than enough for you to remember at this point. Okay. Then trigeminal. I told you about trigeminal. Trigeminal is a mixed nerve. Mixed nerve will mean that it carries both motor fibers and sensory fibers. Motor fibers are for the movement. Sensory fibers are to carry sensations. Okay. So, which movement does trigeminal nerve help with? Chewing. Okay. Which sensations does the trigeminal nerve carry? It carries the sensations of the face. All the sensations, touch, pain, temperature, pressure over the face is carried by trigeminal nerve. And I can chew because of the trigeminal nerve. Trigeminal nerve is of three types: V1, V2, V3. Okay. V1 supplies in this T area. Okay. V2 supplies on the maxillary area. V3 supplies on the mandibular area. Okay. This area, forehead is V1. Maxilla, this bone, maxilla is V2. And V3 is mandible. Done. So if they ask that the patient is not feeling sensations over here. Which nerve is injured? Fifth nerve, that is trigeminal nerve is injured. Especially V2 is injured. If they ask the patient does not feel sensation here, then V3 is injured. Done? Then we move on to the next important cranial nerve, facial nerve. Facial nerve is again a mixed nerve. So, motor, sensory. Motor, it controls the facial movements. I am able to do this all because of my facial nerve. This frowning is also due to facial nerve. So, which movements it carries? Facial. Which sensations it carries? I told you to remember, the tongue is divided into two parts. Anterior 2/3, that when we stick out our tongue, that we see anterior 2/3, and posterior 1/3. Posterior 1/3. And this I mind you, it is your question only. Okay. So anterior 2/3, the sensations from anterior 2/3 of the tongue is carried by 7th cranial nerve, facial nerve. But the sensations from the posterior 1/3 of the tongue is carried by 9th nerve. 9th nerve. In the question they will ask you, there is a patient in which we keep sugar over the tip of the tongue. Tip of the tongue means anterior 2/3. Okay. And the patient is not able to feel any sensation. Which nerve is injured? 7th. Tick and move forward. Okay. Fine. Facial nerve. Then facial nerve also supplies the salivary gland. And mind you, this is also your question. A person is not able to produce saliva. Which nerve is injured? Facial nerve. Salivary gland. Okay. And if facial nerve is injured, what is the disorder's name? Bell's palsy. Bell's palsy. Only 4 things that you will remember, and all the questions you will be able to do about the facial nerve. Facial nerve is a mixed nerve. Mixed nerve means it will carry motor and sensory features. Motor features, it supplies the facial muscle. If I am not able to blow, if I am not able to do this, means facial nerve is gone. If I do not feel taste from my anterior 2/3 of the trunk, then facial is gone. If I am not able to produce saliva, then facial is gone. Okay. Then coming to the 9th nerve. Which is the 9th nerve? 9th nerve is glossopharyngeal. And again this is a mixed nerve. 9th nerve carries sensations from the posterior 1/3 of the tongue. Posterior, anterior 2/3, facial. Posterior 1/3, 9th nerve. Also it supplies pharynx. Pharynx is where the throat is. Okay. And helps us in swallowing. So if the person has difficulty in swallowing, you must understand that the 9th nerve is gone. Okay. Okay, understood? Fine. Then 10th nerve is vagus. 10th is vagus. About vagus, remember just one thing, that it is the longest cranial nerve or the largest cranial nerve. No one will ask you. 11th cranial nerve supplies the shoulder. If this is injured, we will not be able to do this shrugging of shoulders. And last is hypoglossal nerve. Hypoglossal nerve supplies the tongue, but muscles of the tongue. You ask the patient to stick out the tongue, and when the patient sticks out tongue, if it is in the straight line, hypoglossal is intact. If it is not in the straight line, then hypoglossal is not working fine. So, what do you remember from cranial nerves? You remember that there are 3 pure sensory nerves. 1, 2, 8. Cranial nerve 1, cranial nerve 2 and cranial nerve 8 are pure sensory. They don't carry motor fibers. This is your one question. Okay. Total how many nerves are there? 12. Names you remember. Then you remember about tongue. Who supplies anterior 2/3 of the tongue? 7th nerve. Who supplies posterior 1/3 of the tongue? 9th nerve. And who supplies the muscles of the tongue? 12th nerve. Okay, 12th nerve. 3 nerves you have to remember which are related with the tongue. 7th, 9th and 12th. Okay. Then 5th nerve help us to chew food. 9th nerve help us to swallow food. And 7th nerve produces the saliva in the mouth. produces the saliva in the mouth. Done, done, done. Remembered? Remembered? Okay. So this is about the cranial nerves that you need to remember. Fine.